Okay, so welcome back. We were discussing about the essential steps under the heading called collection of data or examination. So in this, we started with obtaining approval from authorities, budgeting, scheduling, and if at all you are going with health examination survey, approval for emergency care and referral. Then we had also told about what is validity and reliability. So validity is the ability to measure what it is supposed to measure, and reliability is also known as the reproducibility, where especially when you are going with many number of data collectors, you should have a consensus as far as the recording is concerned. Otherwise, it can affect the outcome of your study. So, in order to have validity and reliability, one method to ensure that is standardization, training, and calibration. What is the meaning of the standardization? Is suppose you are planning to record dental caries, all of you should be standardized to record the same performa or the same sheet for recording. So there has to be, for example, those who have attended the posting and know about this index will be able to correlate. There are two indices, for example, DMFT and DMFS. One is the tooth index and one is the surface index to record dental caries. So it is not standardized. If at all some people record DMFT, the others record DMFS. If you are recording DMFT, everybody should record DMFT. It is DMFS, everybody should record DMFS. For that matter, any index. So there has to be a standardization. There has to be standardization as far as your instruments are used. For example, it is always recommended that if you are going according to the original criteria of DMFT 1938, you are supposed to use an Explorer. Whereas if you are going as per the 1997 modification, you are supposed to use a CPATM probe. So it is not right or standardized when some of you use an Explorer, some of you use a probe, some of you use a CPATM probe. That makes the results unreliable. So for that, you need to always have the same set of instruments, the same make of instruments. For example, if you are measuring pocket, there are different types of graduated probes. So stick on to the same probe. That minimizes the errors. That is called the standardization. And not only standardization, you should have an adequate training and calibration of the examiners. For example, if 15 of you are going for data collection, 1 or 2 days of training should be there. Now this training will ensure that there are no errors. Everybody records alike, and that finally helps in reducing the errors due to data collection. Okay. So for a health examination survey, there has to be a validity and training and standardization procedures have to be done for the examiners who are going to examine the population. The same goes with the questionnaire. For example, if you have a questionnaire or you have a health interview survey, what your method of collecting data should be uniform. The same questionnaire should be used for everybody. It doesn't mean that each data collector uses their own questionnaire to collect. So that is where there is a lack of standardization. So everywhere there has to be a standardization and there has to be a proper training given for the examiners. This is mainly done to avoid bias or avoid lack of reliability. So that is a step that is very much essential before you start the data collection. So far we have been preparing for the data collection. Now the last in that is collection of data, or if it is examination of patients. Okay, so in our example, we would go with examination. If it was a questionnaire or an awareness study, it goes with questionnaire. So depending on which type of survey you are doing, this part changes. If you are going for health examination survey, like the example we are discussing about, you can go ahead with the examination. If it is health interview survey, the data is collected through interviewing the people. If it is health record survey, there is nobody involved, go to the record section, collect from the pre-existing records. And for this, if it is a questionnaire survey, distribute the questionnaire and collect the data. So this step differs depending on what type of data collection method you are employing in your study. So validity and reliability, just that was what I was explaining. Validity is just it should measure what it is intended to measure. Reliability is called reproducibility and can be enhanced by standardization, training, and calibration. Now, another important short note, what are the different types of examination? This is not only in relation to survey. As far as dentistry is concerned, your ADM, American Dental Association, divides the type of examination into 4. The first is called the complete examination. Second is called limited examination. Third is called inspection. And the fourth is called screening. What are the differences between these 4 types of examination? Complete examination involves a very complete examination of the entire oral cavity using diagnostic instruments, good illumination, radiographs, lab investigations, study models, whatever sort of investigation is required, everything is done. That is called as complete dental examination using all aids. The second is called limited examination, where you examine the oral cavity using the diagnostic instruments, that is a Morphonet Explorer, and you might take radiographs as well. It could be a bite wing or an IOP, but radiographs are also taken. So, oral examination using diagnostic instruments plus radiographs is called limited examination. The third type is called as inspection, where there is only use of diagnostic instruments. There is no radiographs. You are just examining the oral cavity using diagnostic instruments under a proper illumination. The fourth type is called screening, where you do not use the diagnostic instruments at all. Either maximum what you'll be using is only a tongue depressor or an ice cream stick. Just depress the tongue and gain a visibility. So the tongue depressor is the only thing that is used, and the patients are examined. So by default, when you talk about survey, when you go to an epidemiological survey, usually what is carried out is type 3 and type 4, which is better of them is type 3, because type 4, when you don't use any instrument, especially when there is the purpose of your diagnostic instruments are not just for diagnosing, it is for even illumination, retraction, your visibility, all that gets enhanced when you use these diagnostic instruments. So that is preferred over type 4. Type 4 is just asking the patient to open the mouth, just examining. If at all you are depressing the tongue, you can just gain a better view of the teeth, and that is not usually recommended. So in a survey, usually type 3 or type 4 are done. Whereas if the survey is conducted in a dental college or a clinic, you can go with type 1 or type 2. So it all depends on what type of examination you do. So in our example, definitely we will go with type 3, because it is not possible to do a complete examination in the school, neither take a radiograph there, not for a study model there. So we will prefer type 3. So most of the surveys are type 3 or type 4. Whereas if at all by chance you are conducting the survey in where you can have a provision of all these examinations, you can have type 1 or type 2. So this is an important short note question. What are the types of examination? It is also known as ADA types of examination. Now training. So next is we told about training and standardization. So training is usually recommended for a period of 2 days. If you are talking about health examination survey, training is recommended for a period of 2 days with the calibration. Calibration is repeatedly training and scoring and seeing whether it is correct. It is done for 2 to 3 days. So that is what we told about this example. You have to use the same make, same type of instruments, same index for recording, follow uniform criteria. All this helps in standardizing. Now, validity of a test is assessed using sensitivity, specificity, positive predictive value, and negative predictive value. I think we have discussed in detail about this in the concept called screening. This has already been the sensitivity, specificity, positive predictive value, and negative predictive value. That is how you analyze the validity of a test. For example, how valid is RT-PCR for diagnosing COVID-19? You need to assess the sensitivity of RT-PCR, the ability to identify true positives, the specificity, the ability to identify true negatives, and how positive and negative predictive they are. This gives the validity of the test. And this was discussed in detail as a separate chapter called the concept of screening. And reliability is measured using statistics known as Cohen's kappa. Cohen's K, it is not K, it's Greek letter kappa. Now Cohen's kappa can have a value ranging from 0 to 1. 0 means there is no agreement, and 1 means there is absolute agreement. Or if you are talking about in percentage, it ranges from 0% to 100%. So at least a 0.8 or 80% agreement should be there to consider it reliable. You cannot always ensure 100% reliability, but at least 80% is acceptable in most of the studies. Okay, so if there is a reliability of 80%, at least everybody is measuring almost the same. If not, 80 or above is definitely good. What is ultimate is 100%, but at least 80% should be there for considering it as a good reliability. And if at all you are talking about health examination survey, like our example, you should take additional care of sterilization, infection control, because you'll be using these instruments. You have a lot of population to cover, so you should take adequate steps to ensure proper cleaning, proper sterilization, and you might have the requirement of an auxiliary staff for organizing or recording. You might require auxiliaries also, especially this is all required when you go for a health examination survey. When you talk about a questionnaire survey, the questionnaires are collected, sometimes it is distributed through emails, sometimes through SMS or postal mails, or sometimes it is through telephonic interview. And questions are of two types. Whenever you talk about the questionnaire, you have two types of questions. One is called as an open-ended question, the other is called as a closed-ended question. For example, question number 1, are you aware of IDA? The answer is yes or no. Such kind of a question is called as closed-ended, where you have a limited option to select. The second question, what does IDA stand for? That is an open-ended question where the respondents can write whatever they want there. It is not a fixed answer. So these are two types of question when you design a questionnaire. You can have an open-ended question or a closed-ended question. So whenever you are drafting a new questionnaire, you need to check for validity of that questionnaire. That is, for example, it is like making a question paper. You need to check whether that question paper is relevant to the topics that are given to you. That is called as validity. Suppose you are given 10 topics to study for first internals and I ask a question which is not there in those 10 topics. It is not valid. So validity is assessment of whether it is measuring what it is supposed to measure. So whether the questionnaire is having a content, it is measured in two aspects. One is called as a content validity, the other is called the face validity. Content validity is in relation to content, and a broader way of assessing is called as face validity. You don't need to go about that in detail, just know that the validity is assessed using content validity and face validity. And reliability is assessed using Cronbach's alpha and kappa statistics and split half consistency. These are the three methods to assess the reliability of a questionnaire. Just familiarize with these terms. You need not know how it is assessed. Just know these terms, or even it can help you in Viva. So that is about data collection. Now we come to the next step, that is called analyzing the data. Analyzing the data is once we get all these data, we sit together and you compile the data, you convert it into numbers, you conduct what is known as biostatistical tests. That is a whole big chapter for you. So do that, you will get to know when we discuss the chapter called biostatistics. There are an array of tests that can be done and all these mathematical calculations, comparisons, and then finally you get to know what is the objective in terms of your result. So analyze the data. Analyzing the data itself is a very huge step. We'll be discussing about that in detail in biostatistics. Once you analyze the data, you draw a conclusion. The prevalence of dental caries among 12-year-old school children in Delhi is so much percent. That is called drawing. And how much it is in males, how much it is in females. Is there any difference between males and females? There is a difference between the different schools. All these types of conclusions you can draw after analyzing the data. And once you conclude, you should not just sit quiet, because all these research is meant to be disseminated. Other people should read about what you have done so that they can also understand that the prevalence of caries in Delhi is so much. So that is called publishing the result. Always the result has to be published so that people read it, people get to know. That is how the exchange of information occurs across different research groups. So this is called publishing the result. This is the last step in survey. Okay, so the survey ends with publishing the results. So if you are going to the 7 essential steps, first is establishing the objective. Next is called designing the investigation. The third is called selection of sample. Fourth is collection of data or examination. Fifth is analyzing the data. Sixth is drawing the conclusion. And the last is publishing the results. So with this, we end the 7 steps in survey. And the next class, I'll be posting a video on what are the different types of oral health surveys that are done, and what are the different age groups which are recommended by WHO for conducting the survey. Okay, so that's all for today. Thank you.